Hello guys, myself Dr. Syed Nazim Hussain. I'm a consultant dermatologist and aesthetic surgeon practicing at Max Hospital Gurgaon and at my clinic by name RLC Skin Hair and Laser Clinic, which is located at Saket, New Delhi. Now today the topic is about lip fillers and what are perfect lips, how to get perfect shape in the lips, and what products are recommended for the lip fillers and all. Before we touch on this topic, it's very important to understand the lip aesthetics and when should we consider the lip fillers and what should be the product used, what concentration of HA is supposed to be injected. So lips are something which is a very important aesthetic feature of a female face. Like I must tell you that the beauty trends keep coming and going, but beautiful lips are always in style. Okay, it represents the female attractiveness of female's face. So this is something a very important features of female face. Okay, now before you opt for any aesthetic surgeon or a dermatologist or a plastic surgeon for lip aesthetics and you ask them to do your lip injections or lip augmentation, it's important to understand what are the features of a beautiful lip. Okay, it's very important to have a very natural results. Okay, which is something like most of people don't know. They randomly go and they ask, okay, I just want a lip like they quote about some actress like this and blah blah, which is not good. Like you have to have the best in yourself. Now first we go, I must tell you there are different shapes of the lips. Like it can be an apple shape of the lip, it can be a heart shape, it can be elliptical shape, it can be ribbon shapes, and these all the shapes can be done with the help of dermal fillers on a particular female face. But then what is important to understand that what is good for that particular face, that is something what many of doctors don't know. So understanding the aesthetics of a face, particular face, that particular person is very important. Now before you go ahead for the lip fillers, you must understand that there has to be some projections in the lip. Like upper lip has to be projected more anterior, say 1 to 2 millimeter anterior to the lower lip, and likewise there are some anatomical features on the lips. It's not just the body of the lip, it is equally important the philtral columns, these two columns, the length of those columns, the appropriateness of those columns are very important. The cupid's bow, the V-shaped feature of the upper lip, it's very important. The corners, oral commissures, their distance, their position, their fullness is important, because we know as we age, after 30 years of age, all those features go down. There is a change in the facial features because of a lot of reasons, the gravitational pull, because of redistribution of your facial fat pads, because of reabsorption of bones of our face. So the lip deflates. Okay, it's not the same. So there are two ways to do lip aesthetic. One is for anti-aging, someone who's above 50 years of age, and because of the deflation of the lip, the structure of lip is no more what it used to be during the youthful days. And one is for a youthful girl, which is like a younger girl which is looking for more augmentation on the lip, more projection in the lip, or going for a specific shape of the lip. Fine. So as I said, there are some definitions, like the lower lip has to be fuller than upper lip. So it is 1:2/3 it has to be the mass of the lower lip, then, and the 1/3 we consider the upper lip. And there are certain projections. As I said, the upper lip should be anteriorly projected 1 to 2 millimeters, and there are some areas which needs to be given a different proper attention. Now how is this done? Now let me talk about these dermal fillers. So there are different companies available nowadays in market in India. I don't want to quote about the companies or specific product, but basically they are called dermal fillers. Okay, they have an HA concentration of around 16% to 20%, and there is a cross linkers in these HA. They come in a gel, a syringe filled up with a gel, 1 ml basically. They are very smooth. The hyaluronic acid is something which is an internal part of our body. Like we have the collagen in our body, likewise we have some concentration of HA in our skin, and that HA is manufactured through different processes, and it comes up a pre-filled syringe of 1 ml which is available. And the people who are certified, who know how to do these procedures and all, you can consult them and get it done. Now what needs to be done before you go ahead with this, and what are the considerations? As I said, always ask for what suits your face. Don't ask for specific lip. Okay, you might, someone who has a specific, like an oval face, might not go well with a heart-shaped lip. Maybe a different kind of a lip or a different shape which is good for a particular face will look better on that patient. Now about the procedure, it is around 20 minutes of a procedure. So at different points these aliquots of these fillers are given, and sometimes we give, as I said, we give the projections in apart from the lip, the corners of the mouth, needs to be lifted a bit, the filter column needs to be filled, the cupid's bow needs to be made more sharper rather than just fixing the volume of the lip. So these are some considerations, and it has to be as per the ratio, Phi's ratio, the golden ratio of Phi, 1:1.6 between the upper and lower lip. And it is done, as I said, 1 ml syringe. There's a small needle, 31 gauge or 30 gauge needle attached to that, and small allocots are deposited in the upper and lower lip. It takes around 20 minutes to finish the procedure, and these syringes do have a numbing gel with it, so you may not feel any kind of a pain while doing the procedure, and immediately post procedure you can notice the results. It's very immediate. You don't need any kind of sittings, 2-3 sittings. It's done in just one single session, and the results are instant. It's quite safe. It's a lunchtime procedure. You get it and you go out and immediately it is done. Post procedure, what can happen at the worst scenarios? If I talk about the complications, it can be a bruise, it can be a swelling which can settle down with simple kind of cold sponges, or it can settle down of its own, or applying some arnica creams. And we advise our patients not to put lipstick for a couple of hours, and when it after 2-3 days that swelling settles down and it looks more natural. However, sometimes there can be a little bit of asymmetries which you can come back to the particular doctor, he can fix it. And that's all about lip augmentation and lip fillers. If you have any queries related to this topic, kindly drop a text and call us, or you can comment in this video and we will get back to you. Thank you very much.